If you're wondering what happens during a microsuction earwax removal at Hearing First Oxford, this video's for you. When you arrive at our clinic at 45 Raleigh Park Road, inside Raleigh Park Clinic, we'll greet you warmly and make you comfortable. First, your audiologist will take a moment to talk with you about any ear symptoms you have, such as hearing loss, fullness, itching, or discomfort. This helps us understand your history and what to look for. Next comes the examination. Using a small endoscope with a camera, your audiologist will gently look inside your ear canal. This gives a clear, real-time view on screen, allowing us to check exactly where the earwax is, how much there is, and whether there are any complications like redness, irritation, or fragile skin. Once we've assessed your ears, we begin the microsuction routine. This involves a small, medical-grade suction tube that gently removes the earwax, all under direct visual control. Because we can see what we're doing, the removal is precise, safe, and minimally invasive. If the wax is hard or impacted, sometimes we may use a microhook or fine instrument to carefully loosen stubborn wax before suctioning. Every step is done with care and attention. The whole process is quick, usually just a few minutes per ear, and for many, the relief is immediate. You may notice your hearing becomes clearer, background noise sharper, or pressure and fullness disappear. After the procedure, your audiologist will give you aftercare advice, how to keep your ears clean, when to have a follow-up, and tips to avoid future wax buildup. We want you to feel informed, comfortable, and confident from the moment you walk into the moment you leave with clearer hearing. If you're ready for a safe, professional earwax removal, click the link in the description to book your appointment. We look forward to welcoming you at Hearing First Oxford.